Hi, welcome to Concise Approaches of Internal Medicine. My name is Marisabel Rostro Porcila, and today we're talking about preeclampsia and chronic hypertension. Preeclampsia is a complication of pregnancy which consists on high blood pressure with high levels of protein in urine, which indicates a kidney damage. It can also have any other signs of organ damage, and it starts after the 20th week of gestation. There are multiple risk factors, which include preeclampsia in a previous pregnancy, being pregnant with multiple fetuses, type 1 or type 2 diabetes before the gestation, chronic renal disease and chronic hypertension before the gestation, obesity, and being over 40 years old. Blood pressure is the force the blood applies against the blood vessels during circulation, and hypertension is when the blood vessels have a permanent high pressure against them. We define as hypertension as a systolic pressure greater than 140 millimeters of mercury and a diastolic pressure greater than 90 millimeters of mercury. Many articles have concluded that hypertensive disease of pregnancy effects are limited to the affected pregnancy, and there are few long-term maternal effects, if any. But there have been multiple studies that support the association between hypertensive pregnancy disorders and future chronic hypertension, as well as ischemic heart disease, stroke, and cardiovascular death. In a study, half of the women with history of preeclampsia were hypertensive 10 years after delivery, and one-third were hypertensive 5 years after the delivery. What is the association? Well, endothelial dysfunction plays an important role in both preeclampsia and hypertension. Both conditions have similar risk factors such as obesity, diabetes, and inflammation, which might result in endothelial dysfunction, increasing the risk of both. Preeclampsia might induce irreversible vascular damage and metabolic changes that might increase the risk of hypertension and cardiovascular disease. Several mediators of endothelial dysfunction have shown to be upregulated in preeclampsia, which includes cellular fibronectin, von Willebrand factor, and cellular adhesion molecules. The interaction between the endothelial dysfunction, the metabolic abnormalities, the oxidative stress, the inflammation, and the hypercoagulability state result in a multisystemic vascular damage, which creates a systemic vasoconstriction. So, is preeclampsia associated with an increased risk of hypertension? Yes, evidence suggests that it is. It could be up to 3.6 times the risk of chronic hypertension if you have history of any hypertensive disorders, and up to 6.2 times if you have history of preeclampsia in any pregnancy. So what does this happen? Well, the cardiac structure and function changes. The left ventricle is remodeled with a diastolic dysfunction and reduced cardiac contractility, which persists after the delivery. This increases the risk of chronic hypertension. Also, the endothelial dysfunction continues to be present after the delivery and the resolution of preeclampsia of the affected pregnancy, but there are many theories. So how do you prevent it? You can reduce the occurrence of preeclampsia with a healthy lifestyle and low-dose aspirin, which it's 81 milligrams a day after 12 weeks of gestation, which is given if you have one high risk factor or more than one moderate risk factors. You can also take postnatal care as annual blood pressure measurements and early screening for cardiovascular disease. These are the sources used for this video. Thanks for your attention.